Yeah, so I've always been interested in public health, mainly through a personal interest in health and wellness. And it wasn't until my doctoral training at the University of California at San Diego in public health that I started applying my interest in public health and disease prevention to cancer research. So I was a research assistant at the Cancer Center at UC San Diego and worked on a number of studies as a research assistant related to lifestyle as it relates to cancer risk and survivorship. And it was through that hands-on training that it really piqued my interest in applying my research in public health to cancer prevention. I subsequently pursued a doctoral dissertation project focused in cancer epidemiology and now a postdoc. I was really interested in expanding on the work that I was doing as a doctoral student related to lifestyle factors in cancer risk and prognosis, and was interested in incorporating more molecular biomarkers into my research in lifestyle and cancer. And I was specifically interested in working with Dr. Timothy Rebick, who's my postdoctoral mentor, who's an expert in the field of genetic and molecular epidemiology. I was also interested in gaining more formalized training in cancer epidemiology, given that my doctoral work was more broadly focused in public health. And then finally, I think a unique aspect of the Harvard Chan School is the proximity to the medical centers in the Harvard Longwood and the Longwood Medical Campus. So I currently also work at the Dana-Farber Cancer Institute. So in addition to having the traditional academic medical setting here at the Chan School, it's been wonderful to have the direct access to patient populations. My research is really focused on understanding the impact of different lifestyle and energy balance factors on the biology and etiology of different cancer types, and thinking about how we can use that knowledge to inform evidence-based prevention and early detection strategies. I am particularly interested in less commonly studied and more rare cancers like multiple myeloma, which is a blood cancer. And I'm specifically interested in that given that there are currently few known prevention strategies available for clinicians and patients to use, and there are the lack of known early detection strategies. One of the primary resources is the access to the large prospective cohorts like the Nurses Health Study and Health Professionals Follow-Up Study. So particularly in studying rare cancers like multiple myeloma, the access to these large cohorts are uniquely beneficial because there's a sufficient number of individuals that are diagnosed with these rare cancers over follow-up which have allowed me to conduct some interesting hypothesis-generating research. I've also been able to be a part of the development of a large prospective cohort study that's currently underway in collaboration with my mentor, Tim Rebick. And having the resources and expertise of cohort investigators here at the Harvard Chan School that have been instrumental in the development of the existing large prospective cohort studies, I think has really contributed to the success of that ongoing study. In addition to being around top-notch students and faculty members, I think one of the experiences that I think has been really rewarding to me is just it's been an extremely motivating experience. You're constantly surrounded by people who aren't afraid to dream big, even in the face sometimes of failure. And I think being around people who are willing to be relentless in pursuing big ideas has been really instrumental in helping encourage me to pursue opportunities that I wouldn't have otherwise. So I think it's kind of reflecting back to when I first came to the Chan School, attending some of the first lectures and seminars and being in a room with some of the people whose seminal papers and textbooks I studied as a doctoral student in my training. And I remember being a little starstruck, and it's fun to reflect on those memories largely because these are now people who I consider mentors and collaborators and who I go to for advice.